Well, as we were hearing yesterday, Berkshire's hospitals are beginning to turn their attention to the future as the number of patients being treated for coronavirus tails off. So, what went well, what went wrong when the crisis took hold? It put huge pressure on our health services. The views of patients will be vital if we're to learn the right lessons, and it's something our political reporter Patrick O'Hagan has been delving into for us. Patrick, hello to you. Whose job is it to find out what patients have been thinking?
Well, a lot of people have a part to play in this. I mean, obviously, the hospitals, such as the Royal Berkshire, Wexham Park and Frimley Park, are going to be doing their own research to catch up with patients who they've been treating. As you and I were talking through last night, Phil, Wexham and Frimley have already carried out their very own short survey with their recovering patients to see what physical and also mental impacts the stay that they had in the hospitals actually had on them. And that early research showed that roughly 60% of people were feeling well on track towards getting back to normal, but it also showed that 10% of patients are really struggling with what they had to deal with emotionally as well as the physical impacts, obviously. But one of the lesser-known groups, which also has a big role to play in all of this, is what's called a patients group called Healthwatch. Now, the West Berkshire version of that organisation is just starting to carry its own research, saying that if you're maybe a little bit too nervous to tell the hospital or GP who helped you through your illness what you really thought about how they treated you, then maybe you should come to us, because we can talk to you anonymously and then make sure that information goes forward to the health service to make sure they actually hear what you really thought about how you were treated.
And what are they doing then to gather those opinions?
Well, Healthwatch West Berkshire have actually just released a survey, and they say that will prove vital in learning the lessons of the past few months. Let's hear from their chief executive, a man called Andrew Sharp.
People really don't know what the sort of post-lockdown phase is going to deliver. They're obviously planning for what they think is going to happen, but this is where surveys and information from the public come in so importantly on this sort of thing, and we've never done it before.
And that's, of course, the whole point of the research. Now, Healthwatch say that hospitals, GP surgeries, councils, and all the other people involved in helping people through this crisis may well think, they've got their own ideas, and quite rightly so, about what they think needs to be done to improve services if, God forbid, a future pandemic hits. But Healthwatch also say what they really need to do is listen to the people who've been through it already, get their opinions. To be fair, Healthwatch does say all the local services they've been talking to ever since this crisis hit have been talking to patients, but clearly Healthwatch have a big part to play in this for the future.
And what sort of questions will they be asking?
Well, clearly they want to know how people felt staff treated them while they're in hospital, their GP surgery, whatever. But Healthwatch also wants to know much more about how people were helped by other services right across the spectrum. Here's Andrew Sharp again.
We'll be asking people, did you try and get through to the GP, or did you have an outpatient appointment? Were you offered a telephone appointment, a video appointment? Did it work? Did it not work? And equally, one of the really important things is for the people who didn't use any services, well, why didn't you use any services? Was it because you didn't need to? Or you thought, well, I'll put it off because the NHS is busy? Or, equally, how's this affected your mental health?
Yes, they're going to gather a lot of information. What will happen to it as they gather it?
Yes, there will be a lot of information, and so the real ideal is what they're really after is the quality which will come from this. They're not expecting huge numbers to apply to this, but usually when groups like Healthwatch put these services out, you get very accurate information, very heartfelt information about how people think they've actually been treated by the various elements of the health service. So once Healthwatch West Berkshire get hold of all of this, they'll clearly send that information on to the Royal Berkshire Hospital, for example, GP surgeries in West Berkshire, which also actually includes the area around Wokingham and Reading, and also all the other parts of the health service which work daily in the background deciding what the key priorities are for local health services, because there are lots of groups in the background and I won't bore you with their titles, and it's their job to decide what the most important things are that a health service should be looking at and where all of the money, most importantly, should go. So the information which Healthwatch wants to gather will be absolutely key to what happens in the future, both in terms of how it helps people recover from what they've been through at the moment, and also if we do get a future pandemic. Now, if you're listening to this and you want to actually go online, think this is your kind of thing, and you want to help out Healthwatch, it's very simple. Just type in Healthwatch West Berkshire, if you can say West Berkshire, probably that is, Phil, and all the information will pop up for you.
Excellent. Thank you very much indeed. Patrick O'Hagan, our political reporter then, Healthwatch West Berkshire, if you want to take part in that survey.